Go ahead.
Yes, sir. Okay, coming to the vaccinations, we will be discussing about the available vaccinations for hepatitis A, B, C, and E. Coming to hepatitis A, now coming to pre-exposure and post-exposure. So for pre-exposure, what is a group that is targeted for hepatitis A vaccine? That is travelers to areas of high endemicity and patients with CLD, hemophilia patients, MSMs, and those who are working with primates carrying a hepatitis A virus infection, or people who are working in hepatitis A virus research laboratory, IV drug users. And coming to post exposure, it will be usually those who have traveled to endemic areas in the last few days, within the last 2 weeks, especially. Next slide, please. Yeah. And the antibodies to hepatitis A vaccine, they can be detectable up to 2 to 4 weeks after administering the vaccine. And usually inactivated hepatitis A vaccine will be given and given intramuscularly into the deltoid muscle in a 2-dose schedule. And the first dose will be given at the age of 1 year or older. And the dosing interval between the first dose and the second dose can range from 6 months to 4 to 5 years, but it is usually between 6 to 18 months. And various hepatitis A vaccines are available. There are 4 inactivated monovalent vaccines, out of which Havrix and Vacta are being commonly used. And the dosing schedules are 0 and 6 to 12 months for both the vaccines. But if the age is less than 18 years, the volume will be 0.5 ml given in 2-dose schedule. And if the age is more than 18 years or older, the volume is 1 ml will be given and in a 2-dose schedule again. And these antibodies after vaccination can even be noted and demonstrated even 25 years after the vaccination. And all the 4 vaccines which are available are of equal efficacy. And hepatitis A immunoglobulin given is usually given at a dose of 0.02 ml per kg body weight as a part of post-exposure prophylaxis, and 0.02 to 0.06 ml per kg body weight as a part of pre-exposure prophylaxis for those who are traveling, and given in a dose of single injection. Now, who should receive this HIV post-exposure prophylaxis? Those who receive, those individuals who are greater than 12 months or older, who are immunocompromised and or have a chronic liver disease, and those who are exposed to hepatitis A virus within the past 14 days. They should receive both immunoglobulin at the rate of 0.1 ml per kg and hepatitis A vaccine at the same visit in a different anatomic site. Now, coming to hepatitis B, we belong to the intermediate zone where 2 to 7% of our population is affected by hepatitis B virus, and hence vaccination for hepatitis B is of utmost importance in order to reach towards eradication. Now, as per WHO, there's an estimation of 296 million people who were living with chronic Hep B in 2019 and 1.5 million who are living in 2021. Now, coming to the vaccine, the quantity of hepatitis B protein per dose, it is different in various vaccine products. That is, there is 5 to 40 microgram of recombinant hepatitis B protein. And usually aluminum phosphate or aluminum hydroxide is used as an adjuvant, and it is given as an IM injection in the anterolateral site of the thigh for infants and children aged less than 2 years, and given in the deltoid muscle for older individuals. Next slide. And the recommended number of doses are usually 3. That is, standard 3-dose vaccine series is usually recommended. 2 priming doses are administered 1 month apart, and a third dose is administered 6 months after the first dose. And there are various schedules, and all of the schedules are proven to be protective. They include, it can be given at birth 1 and 6 months, birth 6 and 14 weeks, or 6, 10 and 14 weeks, and the other schedule would be birth 6, 10 and 14 weeks. An anti-HBs antibody is usually measured, and if the levels are more than 10 or more, measured 1 to 3 months after the administration, that means the protection is present. But however, adequate protection is usually counted as more than 100. And there are very few studies showing presence of adverse effects to the hepatitis B vaccine. We also have another combination vaccine for both hepatitis A and hepatitis B, which is called Twinrix. And the volume of around 1 ml will be given in this. And the dosage schedule is 0, 1, and 6 months in 3 doses will be administered in this vaccination schedule. Next. There are also a few novel vaccines for hepatitis B in order to meet the challenges of non-response or low response among older individuals and immunocompromised individuals. These vaccines stimulate both humoral and cellular immune responses, and they use third generation hepatitis B recombinant vaccines containing HBsAg, pre-S1 and pre-S2 antigens. And they can have only 0 and 1 month schedule. Now coming to hepatitis E vaccine. Hepatitis E vaccine is currently approved for use only in China, where a HEV 239 vaccine has undergone a phase 3 trial and has been tested in around 1,12,000 healthy subjects. And where the predominant genotypes are 1 and 4, and 30 microgram of this vaccine has been used intramuscularly in a dosing schedule of 0, 1, and 6, and which has found satisfactory protection for hepatitis E, and no side effects so far have been noted. But however, this vaccine currently is not approved worldwide. For hepatitis C virus, the vaccine that will be developed should be protective against different HCV variants. And genotype 1 to 6, all the 6 genotypes are epidemiologically significant, and they also differ by 30% and 20% in their sequences between various genotypes and subtypes. And now the vaccine which is going to be produced in hepatitis C, it is currently not, it is only under study in the mouse models, and because of its wide genetic variability, no human vaccine is currently available for hepatitis C. Now, summarizing the talk, vaccines have contributed greatly to the goal of achieving control of viral hepatitis. Immunity to hepatitis A is very important, and it can help us in avoiding acute liver failure, which are secondary to hepatitis A. And with advent of hepatitis B vaccine universally, there's a marked decline in the new cases of Hep B. Currently, no vaccine available for hepatitis C, and safe and effective anti-hepatitis E vaccine is currently needed worldwide. However, it is licensed for use only in China. And hence, vaccines remain an important cornerstone in the battle against viral hepatitis. Thank you.
Thank you very much for summarizing what is the vaccine schedule.